Hi, Miss Kite. What are your symptoms today?
Well, I had like bad chest pains and I called 911 and I apparently had a heart attack and it was all after I had this nosebleed.
Okay. Melissa, will you please take your blood pressure? I'm going to listen to your heart. Kacie, will you write everything down? Take a deep breath for me.
How's it sound?
Okay. How's the blood pressure?
It's very high.
Okay. All right. We're going to go discuss some things, and we'll be back with you, okay?
What's wrong with me?
We'll be back, okay? Cardiac arrest and nosebleed. Go.
Well, it's not the heart because there's no family history, and it's not angina, and there's no prior attacks.
It could be the vessels around the heart, though. Polycarditis nodosa causes cardiac symptoms and hypertension, and could cause the nosebleed as well with a high hypertension.
Nosebleeds and heart racing are scientifically in use.
Well, since there was a blood transfusion, it could be amyloidosis. The IGs are low, she has a failing heart, and there's fluid in her lungs.
There's nothing wrong with her damn blood.
It could be a clotting issue.
DIC, cancer, but it could be in the chest. There's nothing showed up on the X-ray.
Wrong. Miss Kite, what type of blood do you have?
AB?
Wrong.
What? How?
Nothing seems as it appears.
What?
Well, you have type A blood.
What?
But your body's presenting B antigens, so it makes it seem like your body has AB blood.
So?
You got the wrong transfusion.
I hate to tell you this, Miss Kite, but you have lupus.
What? How is that possible? What's lupus? Hey, so what's lupus?
Sorry. Call me off.
Hey, so do you know what lupus is? No? Do you know what lupus is?
Isn't lupus a neurodegenerative problem that ends up causing issues with as you age, and it can build up
Immune system.
So I have a question for you guys. What is lupus?
Guy from Harry Potter.
Hey, can I ask you a question? What's lupus?
I know it's a disease. I can't tell you exactly what the pathological scene is behind it, but that's basically what I know for now.
Well, I'll wrap a question for you. What's lupus?
What's lupus?
Yeah, what is lupus?
It's a disease.
Sure. Do you guys know what lupus is?
I've heard of it. I have no idea what it is, but I watch House.
Hey, can I ask you a question?
Yes.
What's lupus?
Lupus is some sort of a disease.
Okay, thank you. Hey, can I ask you a question? What's lupus?
No idea.
Some sort of disease thing? Doesn't it have to do with like your eyes, maybe?
Hello? Can I ask you guys a question quick? Sure. What's lupus?
Not sure, to be honest.
Thank you. Hi, do you know what lupus is?
No.
No?
Yeah, no.
Hi. Hi, do you know what lupus is?
I don't.
You don't?
No.
No guesses?
Mm-mm.
Not at all?
No.
Not even one?
No.
It's a disease. Any type of disease you might think it will be?
No.
Okay. Hey, can you tell me what lupus is?
No.
Why?
Lupus, isn't that a character of Harry Potter?
Hey, do you know what lupus is?
What is it?
Lupus.
No idea.
You don't? No ideas? Not even a guess.
Why?
That's unfortunate. What's lupus?
I don't know what is lupus.
You don't know what it is?
No, I don't know what lupus is. What is that?
Lupus, I know this. It's like, yeah, this is weird. It's like a sickness for like, it's like bones, right? Something with your bones, right? Lupus.
Can I ask you a question, Cliff?
Yeah, sure.
Do you know what lupus is?
I know of it. I'm not quite sure what it is, but I've heard of it.
What if you had to guess?
Some disease. I think it has to do with like facial, maybe your skin, possibly.
Right.
Awesome.
The first case of lupus can date back as far as 460 BC, which is the era of Hippocrates, who was the first to record lupus-like symptoms. In the 1800s, Venetian physicians Ferdinand von Erba and his son-in-law, Moritz Kacie, wrote the first thesis recognizing that the symptoms of lupus extended beyond the skin and affected the organs of the body as well. In 1894, Dr. Thomas Paine, a physician at St. Thomas Hospital in London, recognized that chloroquine might have more general healing powers in lupus, for example, to treat joint pain and fatigue. This discovery paved the way for a century of anti-malarial use in various forms of lupus. In 1903, Canadian physician Sir William Osler wrote the first complete thesis on lupus erythematosus. For the first time, he showed that in addition to classical symptoms such as fevers and aching, the central nervous system, muscles, skeleton, heart, and lungs could potentially be part of the disease. Dr. Osler also identified that lupus could be systemic, for example, that it could affect the entire body, not just one part. He also noticed how lupus could relapse and then flare some months later periodically. In the 1920s and 30s, work began on defining a pathological description of lupus. A major breakthrough came in 1941 when pathologists at the Mount Sinai Hospital in New York City wrote detailed pathological descriptions of lupus. Dr. Paul Klemperer and his colleagues coined the term collagen disease, which led ultimately to our modern classification of lupus as an autoimmune disorder. In 1946, Dr. Malcolm Hargraves, a pathologist from the renowned Mayo Clinic, published a description of the lupus erythematosus, or LE cell. This important development identified the systemic inflammatory part of the disease and allowed doctors to diagnose the disease faster and with greater reliability. In 1949, Dr. Philip Hench demonstrated that a newly discovered hormone called cortisone could treat rheumatoid arthritis. Cortisone was used to treat SLE patients and immediately showed a dramatic ability to save their lives. In the 1950s, the LE cell was shown to be part of the anti-nuclear antibody reaction. This led directly to the development of a series of tests for antibodies which allowed doctors and researchers to identify and define the disease in a more rigorous way. There are the so-called fluorescent tests which detect the antibodies that attack the nucleus of the cell in the anti-nuclear antibody. The word lupus is Latin for wolf. It is attributed to the 13th century physician Rogerus, who used it to describe erosive facial lesions that were reminiscent of a wolf's bite. So what is lupus? Lupus is a chronic autoimmune disease that affects healthy cells and tissues in the body. Some of the most common facts about lupus is that 15% of lupus cases are in children. No two cases are alike, and 90% of the cases of lupus are in women, so 9 out of 10 cases are in women. Another fun fact is that lupus is 3 times more common in Africans, Asians, and Native Americans than it is in whites, and it strikes typically between the ages of 15 and 45, but can also occur in elderly patients as well. There are two types of lupus. Discoid lupus erythematosus, which is called DLE, and systemic lupus erythematosus, which is SLE, which is the more severe and more common type. DLE affects the skin, and it particularly is there are two common types of lupus: discoid lupus erythematosus, which is DLE, and systemic lupus erythematosus, which is SLE. SLE is the more common type of lupus. Discoid lupus erythematosus is commonly associated with the light, the sensitivity to light, and it affects skin which is exposed to light. There's usually no effect on vital organs, and discoid or circular lesions will scar, which is where the type gets its name. Systemic lupus is more severe. It affects the skin, but instead of being localized on the face, it can affect all parts of the skin, and can have effects on vital organs as well, and it can cause scars if it's untreated. It commonly causes a raised scar, which is butterfly shaped, and it's often on the bridge of one's nose. With systemic lupus, blood vessels may be attacked, which sores can develop on fingers most commonly, and it may cause Raynaud's syndrome, which is a sensitivity in the blood vessels due to cold most commonly.
It is important to remember that any treatment for lupus will vary from patient to patient because each patient and each case is different. There are some medications that patients can take to help with lupus. Some are non-steroid anti-inflammatory drugs. Corticosteroids such as prednisone, naproxen, or Aleve are some examples, along with immunosuppressants. There is no cure for lupus, however there are measures one can take in order to alleviate some of the symptoms. Some of them are remaining sun smart, like wearing protective clothing such as long sleeves, hats, and of course sunscreen. Also regular exercise, something simple as walking or jogging, or even dancing or anything like that. No smoking, and eating healthy, eating things like cucumbers, watermelons, carrots, and refrain from drinking alcohol, eating shellfish, or spicy foods, as they can cause symptoms to get worse. And most importantly, rest is very important, so get an adequate amount of sleep.
Signs and symptoms for lupus include achy and swollen joints, numbness in your fingers and toes, sores inside of your mouth and nose, anemia, redness and a rash on your face that looks like a butterfly, photosensitivity and chest pain, protein in your urine, fatigue, seizure, confusion, blood clots, heart attack, miscarriage, and hair loss. Certain drugs such as hydralazine and procainamide may cause lupus-like symptoms. High estrogen levels resulting from pregnancy may also aggravate lupus. It's a great imitator because it mimics many other symptoms. These symptoms can be unclear, they can come and go, and they can change. This makes diagnosing lupus very difficult. Also, there is no single lab test, and results may be due to other illnesses or can be seen in healthy people.
There is no single cause for lupus. However, a combination of genetic, hormonal, and environmental and immune system factors can be behind it.
Aside from the visible effects of systemic lupus, the disease may also inflame and/or damage the connective tissue in the joints, muscles, and skin, along with the membranes surrounding or within the lungs, heart, kidneys, and brain. SLE can also cause kidney disease. Brain involvement is rare, but for some, lupus can cause confusion, depression, seizures, and strokes.
Lupus anticoagulant that binds to phospholipids and proteins associated with the cell membrane. Most patients with a lupus anticoagulant do not actually have lupus, and only a small portion will proceed to develop the disease. Patients with lupus are more likely to develop a lupus anticoagulant than the general population. The disease is characterized by the production of self-antibodies, inflammation, and organ damage. The presence of anti-nuclear antibodies has been detected in the serum of a majority of patients before the onset of clinical disease symptoms, and levels of certain autoantibodies have been found to correlate with disease activity, supporting a role for these antibodies in mediating disease pathology. It is thought that these antibodies form antibody nuclear antigen immune complexes, which deposit in tissues and trigger local inflammation, thereby contributing to tissue injury. Increased apoptosis and defective clearance of apoptotic material are characteristic of the mouse model of lupus and human SLE. Autoantigens typical of lupus cluster in surface blebs of apoptotic cells, increasing their immune exposure. Saturation of physiological processes to safely remove apoptotic debris amplifies autoantigen exposure. B lymphocytes are the cells of the immune system that make antibodies. Inappropriate activation and proliferation of autoreactive memory B cells in the periphery are also characteristic of SLE. T lymphocytes are also thought to contribute to disease progression and pathology. T cells from SLE patients also display abnormal signaling and secrete cytokines that promote inflammation. Another thing we learned about in immunology class was complement. The name of a group of proteins that protect the body against infections is complement. They work by strengthening the body's immune reactions. Complement proteins are used up by the inflammation caused by lupus, which is why people with inflammation due to active lupus often have low complement levels. There are 9 protein groups of complement, so complement is identified by the letter C and the numbers 1 through 9. The most common complement tests for lupus are CH50, C3, and C4. CH50 measures the overall function of complement in the blood. Low levels of C3 or C4 may indicate active lupus. A new combination blood test is using a subset of the C4, called C4D, to help physicians rule in lupus and rule out other diseases and conditions. The body uses antibodies to attack and neutralize foreign substances such as bacteria and viruses. The antibodies your body makes against its own normal cells and tissues plays a large role in lupus. Many of these antibodies are found in a panel or group of tests that are ordered at the same time. The test you will hear about most is called the anti-nuclear antibodies test, referred to as the ANA test. Anti-nuclear antibodies connect or bind to the nucleus or command center of the cell. This process damages and can destroy the cells. While the anti-nuclear antibody is not a specific test for lupus, it is sensitive and does detect the antibodies that are present in 97% of people with the disease. The ANA can be positive in people with other illnesses or positive in people with no illness. Test results can also fluctuate in the same person. However, lupus is usually the diagnosis when these anti-nuclear antibodies are found in your blood.
Look!
Intruder!
Get him!
Hey, do you know what an autoimmune disease is?
What type of blood do you have?
Okay.
There are no single causes for lupus.
Hydralazine and procanamide. I didn't say that right. It's down because you laugh in my face. Having time for you. Certain drugs. Chelsea, why?
Okay. I thought you were calling me a seizure.
Well.
Likely to develop a